Hey guys, welcome back to my YouTube channel. My name is Chidera Haka and I'm a fourth year med student studying medicine in Lagos, Nigeria. Today's video is titled What's in my med school bag, and just like the name implies, I'm going to be showing you what I carry in my bag. Let me introduce you to my bag. This is my school bag. I take this bag everywhere, every time. Clinic, wards, anywhere, like basically. If you're interested in finding out what I have to carry as a med student during my clinical rotations, then you can just keep watching the video. This is one of my school bags. This is my major school bag, and you can guess, like, the main reason is just because it is black. I have a brown school bag. I have a white one that's a knapsack like this one, but I don't use all those other ones as much as I use this one because this is black and it goes with every single thing I wear. The bag is very plain, like there's nothing spectacular about it, just a plain leather bag. And I was looking for something plain, something black, something light. The bag is very important in med school, and if you notice, it is a knapsack, and that is because we do a lot of rounds in med school. It's important that a doctor has to go around checking on patients because that's basically what you do. So we are always going around checking on patients. What rounds involve you walking around, and they involve you standing. You stand, like you stay in front of a patient. You can stay in front of a patient for like 45 minutes. And I started clinical posting the first time, I just carry a handbag, and I noticed that I started having pain on this shoulder. That's because I did most of the weight bearing on this arm, on this shoulder, so it was really painful. So knapsacks help you to distribute the weight evenly between both shoulders, and that's why I just switched up to knapsacks, and most people in clinical rotations switched to using knapsacks. As a med student, the first thing I have to carry in my bag is this is my stethoscope. Yep, this is Littman Classic 2. I have two of these. I have one that's pink, but this is the black one, and the black one I carry around. The pink one is just here in case something happens to this one, basically. So yeah, this is my stethoscope, and it's very important you carry this around with you. Like, they can literally send you out of ward round or clinic if you're not with your stethoscope. This is like your ID card as a doctor. My notebook. This is my notebook. It was given to me by someone, and it is a really nice book. As you can see, I have a lot of stuff in it highlighted and stuff. Then it has this is for my pen, so you can keep extra notes here if you like. This is my pencil case. This is just a very simple transparent pencil case. Next important thing I always carry around is my name tag. This is my name tag. It's important to take this around with you so people can identify who you are. So everyone is expected to have their name tags attached to their clinical codes, so they just stick it everywhere. I have been penalized once for forgetting this. Like, I was told that the fact that I didn't bring this thing just meant that I was not present for clinic, and it was really, really sad that I had to get penalized for forgetting it. So I always put one in my bag because I have two. So I put one in my bag, so in case I forget one, I have one with me. As med students, we're supposed to carry around some tools, some basic tools that we use to check the vital signs and to physically examine patients when they come to the clinic, and it's very essential that we carry these tools around with us wherever we go in our bags. I showed you my stethoscope already. It's the first thing you have to carry around. The stethoscope can be used to do a lot of things when you're in the clinic. Like, listen to the heart sounds, listen to the bowel sounds, different things you can use your stethoscope to assess. It's not just the heart rate. So it's very essential you take this with you as a med student in your bag everywhere you go. So it's not just for show, it's actually useful. Your pen touch is very important. Certain types of examination would need you to have your pen touch. This is my patella hammer, usually used in neurological examinations to check for tendon reflexes. You should have a stethoscope, you should have your patella hammer, you should have your pen touch with you when you're going to the clinic. So other things I carry around are my pulse oximeter. You can see this is a pulse oximeter. Although ideally we're trained to check the pulse rate without using the pulse oximeter themselves, and also I have my thermometer with me as well. As far as I'm going to school, these things are always in my bag. I have my power bank. So right now I'm using it to charge two devices now, but I take my power bank in my bag every single time I'm going. I take it with an extra cord, and I take it with its own cord in case I need to charge it itself. And then I also take I also take my wallet. My wallet is very important. It's super cute. I take it everywhere too as well. I have some ATM cards, my card, money, and any other thing I need. Any other thing you take, put in your wallet, I put in my wallet too. I also take an umbrella. Oh my god, the day rain dealt with me when I was going to clinic. That was the day I knew that nobody's going to listen to you. Well, if rain, but see, the rain is not an excuse for you not to appear for clinic, because patients come all the way from where they are to come and see you as a doctor, and you say, oh, you don't want to come to the clinic because it's raining or you can't enter the rain. That's not an excuse. So you need an umbrella. It always comes in handy. I put it at the side of my bag all the time, like all the time. I'm with my umbrella. So anytime rain is, I don't want to know. Anytime it's raining, I have my umbrella with me. Another thing I carry around are my keys. I have my room key, my house key, and one other key. And then my AirPods are also with me as well too. Next thing I carry in my bag is my nose mask. This is definitely essential while we're in the middle of a pandemic, and so my nose mask is very important. I always take black, and I take at least 2 in my bag every single time I'm going anywhere. Yes. You have to have your hand sanitizer, and this hand sanitizer is very key. Oh my god, I cannot even overemphasize how key your hand sanitizer is in clinical rotations, because it's not just because of pandemic. You're in the hospital. You need to be safe. You need to keep yourself safe. You need to keep the patient safe. So before you do anything on a patient, you sanitize your hand. After you're done with doing anything for the patient, you sanitize your hand so you don't begin to transfer microorganisms from one person to another, from yourself to the patient, and the patient to yourself. So very, very key. I put this I don't put it in my bag. I put it in the pocket of my ward coat. Then I take this book. This is my logbook. I mentioned a logbook in my previous video. If you haven't watched that, you can just see the link to be somewhere here. So this is an example of a logbook for surgery proceeding. When you participate in a procedure, the consultant or the senior doctor in charge would sign somewhere around here to show that, oh, you attended that procedure. So there's a place for surgery. There are other things, maybe for different activities. You sign, you put what you did there, and then they sign to show that, oh, you are a part of the process. Well, basically that's it. The last 2 things that are not here right now. My phone is very important. I'm using that to film. Obviously, my phone is important. So if you try to learn on the spot, if you hear something, check it up, let it stick immediately, and you move on, because there are so many things, you can't keep piling things. So my phone is very important because I check stuff there. I have textbooks on my phone, quick summaries that I can just use. I have one called the guide. I use that one to check a lot of stuff. Then my ward coat. I don't put my ward coat in my bag, except when I'm not using it. I wear my ward coat all the time I'm going to the clinic. For protection, for identification purposes, so people can see you and know that, oh, you are a part of the medical team. Because if you just come wearing your clothes, nobody can identify who you are. So you wear your ward coat and then you put your name tag on it. No mind that these my nails. All these nails are not allowed in med school. You can't be carrying nails like this in med school. I only use these ones during the weekend, and I want to what's it called? When I just want to feel like I'm a girl again, I just fix my nails during the weekend. Just stick on, I take them out during class. I do not use my nails to class. You can't use your nails while examining the patient. No. That's basically everything that I carry around as a med student in my bag while doing my clinical rotations. If you like this video, please give it a big thumbs up. Don't forget to subscribe, like, share, comment, drop a comment. I always reply your comments. Am I leaving anything? In case I'm leaving anything else, you can add that to the comment section. I would really appreciate if you do that. Yeah, so thank you for watching. Until next time, bye.